Hello, my name is John Stadler, and I live with GPA vasculitis. Hi, Dr. Warrington. Thank you for taking my question. I'd like to know if there are any developments or research to help us reduce the dependency on steroids. Thank you.
Wouldn't we all love to be able to treat vasculitis with less prednisone and less steroids, right? I think that's been a goal of researchers for decades. The good news is I think we've made tremendous amounts of progress in this regard for several reasons. I think overall we've learned to use less prednisone, learned to use less steroids over the last several years, and so we've learned more about how to manage prednisone. We have better tools to manage side effects, not all of them, but still we recognize that steroids contribute to a lot of side effects. They contribute to reducing quality of life, as this individual asked, and they have many changes which sometimes we don't always appreciate the significance of those, especially the change in people's appearance, the weight gain, the difficulty with sleep, the issues with regards to bone health, with regards to diabetes, et cetera. And the list goes on and on and on. So I totally agree, that as providers and researchers, we have to continue to work to reducing the prednisone. Now, trials in recent years have shown us that we can use less prednisone than we used to use in the past. So that's already one thing that's been established, is that we can use less prednisone than we did before. Will we get to the point of not using prednisone? Maybe. And one of the most exciting things that I've come across in the last few months or so is the reporting of the trial looking at a medication called avacopan, which is a tablet available that was studied to treat ANCA vasculitis, GPA and MPA, and they were able to remarkably and dramatically reduce the amount of prednisone given to patients by replacing it with avacopan. And so, again, the patients were given rituximab, standard treatments, but then instead of prednisone, they were given avacopan. And the researchers were able to show that the avacopan worked very well, worked just as well as prednisone, and perhaps even better than prednisone, and there was a substantial reduction in the prednisone side effects. So that is certainly, has been the highlight of the research findings for definitely for this year, and is a very exciting advancement. Of course, the FDA is still reviewing that data. The medication is not yet on the market, but we hope that it will be later this year, and I think will be one of the game changers in the treatment of ANCA vasculitis. Again, we have a lot still to learn about the medicine, but it is very exciting to see the dramatic reduction in the use of prednisone with this medication.